What's in it for you? Be selfish. As a caregiver, as a healthcare provider, yes. Jean.
As a healthcare provider, I think it would help reduce family complaints that take a great deal of time if we were more inclusive of caregivers and made them feel part of the process. And oftentimes, as a provider, we feel like we sit on opposite sides of the table when we're all aiming for the same goal. So I think it would reduce complaints, and I think it would also help reduce risk for an organization.
Jean, and you met Jean a few moments ago, Jean from Genesis, who introduced this session. Jean's saying that it has the potential to reduce complaints because when you're partnering with that caregiver and you're finding out what they need, what they want, it has the reduce risk. And did you say reduce risk? Reduce complaints and reduce risk, which I'm guessing you might mean by liability. Yeah, by liability, which is great. Brings me to, there should be, if an organization, if a healthcare organization is truly caregiver inclusive, it is a win-win-win. It's for the patient who's our priority. The person with dementia is our priority. The caregiver and the healthcare professional. It needs to be a win-win-win. What do we get out of it? Just like Jean said, a partnership. When the caregiver feels heard, when the caregiver feels that we know what's going on and we're able to share information, like you said, what Donna said about working with the healthcare insurances, everyone can feel like they're a partnership. When you feel like you're partnering with somebody versus they're a vendor, you're a customer, if you feel like it's a partnership, you see it as everybody's in it together. We're all in it together to get the best care we can for the patient who has dementia. Second, a lot of literature, is suggesting that the more caregiver inclusive a healthcare organization is, errors will go down. You all know this because it's common sense. If a caregiver is part of the process, they're going to be alerting you. Excuse me, Dr. Jones, would you mind washing your hands? I noticed that you didn't wash your hands. Excuse me, ma'am, I see that you're giving my mom medicine. You know, can you please double check that bracelet for a moment, just to put my mind at ease? When we have somebody, we all know this, when you have somebody advocating for you, and we as the healthcare professionals don't look at the caregiver who's saying, can you wash your hands? Can you check mom's bracelet again? When we look at them as a partner, instead of a pain in the neck when they make those comments, we have the opportunity to potentially reduce errors. And it's common sense, because the more eyes and ears on the caregiving situation, the more likely it is we're going to be able to provide better care. Win, win, win.